Well, thank you everybody for joining us, and thank you, Dr. Howard, for being with us to give us an update on COVID and what the city is doing to ensure that everybody's protected and safe. I do want to acknowledge the late Dr. Hartledge, who used to do these briefings and was a really a big supporter of the of our stakeholders and in the international community, and really just promoting health equity overall. Thank you so much for filling in and joining us today. Um, for those who don't know Dr. Howard, he is the medical director for the Metro Department of Public Health and Wellness. He's a practicing surgeon at the University of Louisville and intends to join the Norton Healthcare as a general surgeon in 2022. Um, in 2019, he was appointed as a White House Fellow, where he served as health policy uh, uh, advisor to Vice President of the United States. And prior to that, was appointed Commissioner for Public Health and Chief Medical Officer of the Commonwealth of Kentucky in August of 2017. So you can hear he has an extensive resume, and I'm sure I couldn't tell all of it in just 5 minutes. So I'm going to go ahead and let him go ahead and start and give us an update on the state of COVID-19 in the city and any other information you would like to share with us today. Welcome, Dr. Howard.
Well, thank you for what is a very, very kind introduction. And I will go ahead and say, and I don't mean this in any way other than completely truthfully, totally makes me sound much better than I am. It's just an absolute pleasure to be with this group and really an exciting time to have joined the Louisville Metro Health Department. I think I joined with the health department approximately 6 months or so ago, and I tell you, I got to I got to lead the state Department for Public Health as well as work on healthcare policy at a federal level. And then coming to the Louisville Metro Health Department, I was so unbelievably impressed with the work that was done there, and specifically around COVID. I'll tell you, I attended these briefings on COVID-19, and again, saw briefings on COVID-19 in the White House, and then then coming here to see them in Louisville Metro. No one in this country is doing it better than the Louisville Metro Health Department. And I say that from someone who's seen it everywhere else, and just so proud to have joined this group. Um, I do want to take a moment to acknowledge the passing of Dr. Hartledge, as you did. And uh, Dr. Sarah Beth Hartledge was an amazing public health leader who did an absolutely superb job helping Dr. Sarah Moyer, who's our director, lead the city through the COVID-19 pandemic. And when I came on as medical director, one of the things and I was working with Dr. Hartledge, one of the things I told her was, I'm going to leave everything COVID-19 to you because you've been doing it for 2 years and you've been doing it fantastically. And I know she worked very closely with this group and was very passionate about her work with this group. And so um, I have no information regarding her passing other than to say that it was unbelievably untimely, and she was robbed from us and robbed from this world a little too soon. And our thoughts and prayers go to her family uh, as they as they grieve her, and as we do as well, because she meant a lot to a lot of people, including us at the health department. With that said, if it's okay, I'd like to share my screen, and we'll go through the most latest COVID numbers, and I'll take questions. I will go ahead and tell you, somewhat as a general surgeon, as a surgeon in general, I I probably tend to lean towards brevity. So I will give you the facts of COVID-19, and I'll look forward to having some questions and discussion as you guys see fit moving forward. But I'm gonna go ahead and share my screen, and we'll talk through COVID-19 here. All right, you guys let me know once my screen is shared. Do you all see my, you should see at this point a
Yeah.
browser. Yeah, great. So this is the Jefferson County, the Louisville Metro Health Department's COVID-19 screen. And I hope everybody is able to see that. But as you can see, our total confirmed cases for the last reported week was 819. Our daily average was 15.3. Our weekly incidence rate is 103, and our number of new deaths are 3. But probably what's most important to most people here is what is their current risk status in the city? And as of April 17th, we're in this green category. As a lot of you may recall, there's three categories which are identified here and which are laid out by the Centers for Disease Control, which are green, yellow, and red. And I think I may have a picture for you. So here's the state. Most of our state is green. The green category, Jefferson County being here, our surrounding counties are also green, with only a few yellow or medium risk counties throughout the state, and that's McGoffin, Floyd, and Johnson. The state did a good job of showing us a little diagram of what actually that means, and what that means for people. So, in terms of low risk or green categories, which Jefferson County is currently, are the recommendations from the Centers for Disease Control are stay up with the vaccinations and then use masks on an individual preference. So that's people who are at high risk or people who are specifically concerned about the risk for COVID. We recommend you wear a mask. But in terms of the general public, there's no overarching mask mandate at this point. We do recommend targeted mask mandate in schools and other indoor settings. So people attending sporting events or children in schools who may be at risk or there may be a particularly high risk group, then that group should wear masks under those high risk settings. Again, these are very individualized and very pinpointed toward a particular area. In terms of isolation and quarantine, when folks can think about that is if you're sick, we recommend you stay home. Again, this is Kentucky. We're in the Ohio Valley. So during this time of year, there's lots of seasonal allergies. And I will go ahead and tell you, I moved to Louisville in 2010 from Eastern Kentucky, which is vastly different from Northern Kentucky here in Louisville. And the allergen profile is vastly different. So, specifically to this group, there may be folks who come into this area and find themselves all of a sudden getting lots of runny noses, lots of stuffy noses, lots of itchy eyes. And that can be related to allergies, but those symptoms may mimic that of COVID 19. So if you're having new symptoms, we still recommend those folks to stay home when they might be sick and then explore those symptoms further with our primary care doctor. Kathy, thanks for sharing that website. Appreciate that. Um, and they're currently in the green, as you can see, as provided by the state website. There's no recommendation for physical distancing at this point based on our green status. And then for those that are high risk, we recommend talking with your personal physician or healthcare provider about your risk profile and what that should look like for you going forward. One of the numbers not shown on this website that I tend to like to talk to folks about, and one of the numbers I, as a physician and in the medical director on public health, really watch is hospitalization rate. I will just go and tell you for the state and the city, the hospitalization rate has been fairly steady. The reason I watch that number specifically is that hospitalization rate sort of tells me the severity of COVID 19. And that brings us to a discussion point about the BA2 variant. And I'm sure many people on this call have heard about different COVID variants. And the most recently spreading COVID variant across the globe has been the BA2 variant. I'll just take a moment to say that the BA2 variant is just another subcategory of the Delta variant, which you guys have heard of. So the original Delta variant that caused the spike that we had most recently was called BA1. And then we had the BA2 variant that really caused a big uproar in Europe. And there was lots of number of cases in the European countries. We now have BA2 variant in the US, and there was many stakeholders across the country really concerned that the BA2 variant may cause a significant uptick in cases and may actually cause us to revert to some of our previous recommendations of quarantining, of wearing masks all the time, even in public transportation, and it may put us back to where we were, say, 6 to 9 months ago. However, many public health officials, including myself, did not think that the BA2 variant was going to be as severe in the United States as it was in the European countries. There were several reasons for this, and one of them being the more that in European countries they were more apt to to partake in early early preventative measures, which prevented the widespread of COVID-19 early on. And as in the U.S., we were less adoptive, for better or for worse, of those measures, and that meant that COVID-19 spread more rapidly through our communities, and as a result, we had more natural immunity than perhaps the European countries. Um, which is one of the reasons there is some that we've had seen less effect of BA2 variant because there's some cross reactivity. There's some good news. All the data that we have available suggests that the current vaccination that is available does work against the BA2 variant. I will tell you that the most recent wastewater data that I have seen suggests that there is significant on the BA2 variant in our community, and that it is quickly becoming the dominant strain of COVID-19 in the Louisville metro area, and will continue to be so for the time being. I think the question on everyone's mind is, what does all this mean, and are we going to have another variant that's just going to pop up that's going to be bad again? And the truth is, no one really knows if there's going to be another variant that's going to pop up. I suspect we will see several variants over the course of the period, and we may have some ebb and flow in terms of what our COVID-19 curve looks like. And one of the reasons I was showing um, this curve here, you can see our total number of cases. And what you sort of see is the COVID-19 curve goes up, comes down, goes up. And then even here where you see these plateaus, it sort of goes up again. And I suspect you'll see that over the period. Hopefully we won't see spikes as we did in early 2022 again, but no one can tell you for sure. What I recommend to everyone is consider your individual risk, take precautions based on those individual risks, and get vaccinated. Vaccination is still the most reliable method of preventing severe COVID-19 infections. And for those of you who have been fully vaccinated, meaning a two boosters or two vaccination set, we recommend you get boosted. And most folks are available for one booster, if not two booster vaccinations. With that said, that's a current overview of our COVID-19 situation. I think if I were to tell you the state of COVID-19 in the Louisville Metro, I think we feel pretty confident about where we're at now. We hope the trend continues to decrease over time. Our vaccination rate for the city stays at roughly 65 or so percent. We'd love to see that uptick over time. In terms of vaccination, we do have one minor, what I would say, a minor change to our vaccination strategy. And over the course of May, we're going to start incorporating vaccination for COVID-19 into our routine health department functions. In the past, we have had ran special clinics for COVID-19 vaccination. However, given that COVID-19 infections seem to be decreasing, we have relatively plateaued the number of vaccines we're administered. We're going to pull that into the routine functions of the health department. And we already run several vaccine clinics, so that vaccine will still remain readily available to those who want it in our routine vaccination clinics. So I'm going to stop sharing my screen now and pause for questions. Kathy, before I do that, anything you want to add to my comments?
No, I don't think so. I put a link in the chat to our COVID data dashboard, and I do think one thing to note that we've recently added to that is you can actually see the wastewater testing data on our COVID dashboard now. You have to scroll way down through a lot of the data, but it is, I don't know that it's real time, Dr. Howard. What is the best way to share about the timeliness of that? It's pretty current.
Yeah, so COVID-19 so COVID-19 wastewater data. First off, I'm an epidemiologist in addition to a physician. And so I get a little excited and almost a little bit on the nerdy side when it comes to epidemiological data, which our wastewater data is. Um, so this is, I would tell you, wastewater evaluation for infectious disease is something that's been around a long time, but it's really caught hold during the COVID-19 pandemic across the country. And there's lots of money and lots of funding has went into the evaluation of wastewater data to track our diseases. And as you can imagine, as we all use our sinks and our toilets, that we are expelling certain amounts of waste, and that waste does have viral loads that can be indicative of disease presence in our community. So it's a great source of information about the wellness and the types of infections that are affecting the community. So it's really exciting opportunity for us to monitor diseases, but from a public health standpoint, gauge our responses to those diseases and understanding what the prevalence of the disease might be, because we can't always detect diseases in our communities, which makes it really difficult. We may know that people are getting hospitalized. We may know that people are getting sick, but I don't always know what it is. But this gives us an opportunity to really tap into some interesting data. Now, the data provided on the website usually lags about 5 to 7 days behind, depending on what day you check it. I will tell you that the most recent data that I've seen from wastewater suggests that the BA2 variant is the most common variant of 7 of the 8 tested sites. Now, there are obviously more than 8 possible places in the Louisville Metro or Jefferson County where you could sample wastewater data. However, most recently, in 7 of the 8 tested sites, the BA2 variant of Delta is the most common variant of COVID-19. This isn't surprising at all. I don't think it's a particular reason for concern, but rather is just a data point that allows us to understand what is going on with COVID-19 in our community. And I think wastewater data, epidemiology in general, is a really exciting approach to public health disease management moving forward. That's a great point. Thank you so much, Kathy. Anything else?
No, I don't think so. I think maybe we can turn it back over to Amos and his guests and any questions that they might have.
Yeah, thank you so much for that update. So anybody who has a question, please feel free to unmute and ask your question of Dr. Howard based on what he's presented on or anything else that you would like to learn about.
Real quick, Kathy, will you monitor the chat and let me know if there's any questions in the chat as well?
I am, yes, sir.
Yeah, we'll do.
Thank you.
I have a question, just a comment. I'm very impressed with what you're saying, Doctor, and it's good to hear that. I'm not surprised at what thanks the way you explained it. I'm glad to get the combination of epidemiology as well as that medical practice. Thanks.
Well, thanks so much. I'll tell you, I've been so impressed with what this city has accomplished, and I was just on a call today with the Kentucky Nurses Association, and what an unbelievably fantastic and unique partnership the Louisville Met. I had nothing to do with this, so all this praise has nothing to do with me. I'll tell you this, but the Louisville Metro Health Department had established this really unique partnership with the Kentucky Nurses Association to provide vaccines to the folks of the Jefferson County area, often providing vaccination to communities like this group represents. To folks who didn't know how to provide vaccines, maybe didn't have a primary care provider in the city, and found ways to reach out to them and use the KNA nurses, Kentucky Nurses Association nurses, to provide those vaccinations. And I'm just going to tell you, I've got to see public health from a state and federal level, and you don't see ingenuity, you don't see critical thinking, you don't see people willing to think outside the box to the degree that I've witnessed here in the Louisville Metro, and it's a testament to the work that was done here, but more so a testament to the desire to put everything else aside and just say, hey, we want to get the job done, and we're not going to let bureaucracy or politics or anything else stop us from getting it done and serving the people of the Jefferson County area. And I've been so impressed by that. And again, if you guys ask me here again next year sometime, because I've been a member, I can't praise the health department this much, but I've been so impressed, and I'm just unbelievably blessed and thankful to be counted in the number of a really great health department. Thanks for that comment.
Yeah, we have one question in the chat here. This is the most optimistic update so far. With Derby on the horizon, is there anything particular that you are concerned about? Actually, even Sandra over Louisville tomorrow.
Yeah, so I think that's a really great and timely question. We just did an interview, and I don't want to spoil the news or spoil our interview with the Courier Journal about the upcoming Derby and the festivities that surround Derby. Now, I don't want to be too, and I don't want to, let me first address, I don't want to be too optimistic, and perhaps it's my nature to be a little bit on the optimistic side. COVID-19, as you all know, can certainly throw us curveballs, and it may be back roaring, and we maybe have cases on the rise in 2 weeks, as far as I know. And I think any physician or any public health practitioner that comes to you and says otherwise, I would be very distrustful of that news. But I will tell you that as a physician, as an epidemiologist, and as a public health practitioner, I feel very confident in where we're at now. And I feel like we're in a better position. As someone who lives in the Louisville Metro, who has kids who go to school in the region, I feel very confident in where we're at right now, and in the recommendations that we have made. With that being said, I do think any public health practitioner should be concerned about large group gatherings, and that includes the Derby. However, we certainly have seen a decrease in cases. It is very clear we are in the green category as defined by the Centers for Disease Control, which comes with it no particular stipulations to outdoor gatherings that I'm aware of, with that being in which Derby counts as. I would still caution those folks who feel that they may be at high personal risk to, one, consult a private physician, and two, only take risks that you feel comfortable with. And if you feel comfortable wearing a mask, whether it be on a TARC bus, on an airplane, or at the Derby, then wear a mask. Those common sense measures, if you feel concerned for your own health and well-being, or believe you're at high risk, are well, they're plainly common sense, and I would encourage people to consider those opportunities as they see fit to their own personal health.
Yeah, there's a second question here around boosters, specifically who is eligible or who should get 1 or 2 boosters.
Yeah, so the CDC has recently recommended an expansion of who should get 2 boosters. Kathy, would you mind to send that link? Would you mind to share that link to everyone? There's a fairly significant group of people, and I don't want to miss anyone who should get it, but I actually have it on my desk right now because I have to refer to this every time. But everyone who's, believe it's 50 years or older, people who are 12 years or older who have certain immunocompromised states, or people who got 2 doses, one being the with the primary dose being or the second dose being a Johnson & Johnson vaccination. So again, people 50 years or older, people 12 years or older who may be immunocompromised, or people who got one of the first 2 vaccinations being the Johnson & Johnson vaccine. And Kathy will share that document with everyone. It's readily available on the CDC website.
Thank you so
Again,
much.
I want to, yeah, absolutely, Amos. I do want to emphasize that vaccination is the most important step anyone can take to protecting themselves. What we do know is that for some folks, that immunity does wane over time. So even if you've got a 2 vaccine profile and you're eligible for that booster, I would encourage you to get that booster if you can. And with that said, and I don't think we got a question about it, but the reason the booster is needed is there are some breakthrough cases of COVID-19 that can occur. And I've had folks come and ask me and say, Doctor, why in the world, I was fully vaccinated, why didn't the vaccine prevent me from getting COVID-19? And the truth is, the way that vaccines work is they're never 100% preventative. We know that when we recommend them as physicians, and but what we know is that it is your best opportunity to protect yourself. And I'm going to be honest with you, and I tell folks the same way I do the flu every year. Some level of protection is better than no protection. So please, if you can, get the booster or get your vaccinations, and if you're eligible, get the booster.
Yeah, and we remind people that we're still hosting vaccination events at Americana for those who may need some language services or even are in the area. We have a couple other questions. One is specifically around Johnson & Johnson vax people. So if you received the J&J vaccination, um, how after how long should you seek to get the second booster?
It's usually so it's varied lately. Somewhere between 6 weeks and 12 months, 4 months. Sorry, most people recommend the booster.
There's another booster question. If someone is fully vaccinated but recently had a breakthrough case, how long should they wait to get their booster shot?
There shouldn't be any special waiting period beyond the usual vaccination period. That's a great question, and I've had people come to me and say, "Hey, doc, I've got the COVID. I'm fully vaccinated. I had a breakthrough case of COVID. Do I even need to get the booster?" The answer is yes. Still get the booster. I think we got a question.
Yes, Kevin,
Kevin?
would you like to?
Uh, well, mine is just really, I just want to take use this opportunity to say thank you, Dr. Howard, for doing this. But I also wanted to touch on children. What are the recommendations on children? I know some of them have been vaccinated. I think it's a population that we have that we could probably be mobilizing. Is there any data available regarding children? Is there anything that you can talk about regarding that we could use to motivate children and their parents to get their children vaccinated?
That's an absolutely great question, and I think first off, it's recommended that all children get the COVID vaccine series first off, and that's pretty clear. Greater than 5 years old get the COVID vaccination series. The terms of getting a booster is a little different for kids right now. Currently, it's only recommended for 12 years or older, uh, who have certain immunocompromised states. I will tell you this: I have two kids who are 5 and 7 years old. They're both fully vaccinated, and both have had no adverse events. Early on during COVID vaccination, there were some folks who were really concerned that the rate of myocarditis, or myocardium means the muscle of the heart. The heart is a muscle, so that just refers to the heart muscle. And itis meaning inflammation of the heart. It's a condition just of inflammation of the heart. It's a little a higher risk with a COVID vaccine than it is in adults. I will tell you this: the risk of getting myocarditis, inflammation of the heart, with catching COVID-19 and having that same inflammation of the heart is a greater risk than you would have if you just got the vaccination and had that complication. I hope that makes sense to everyone. If anyone needs me to clarify that or say that more plainly, I will. But the bottom line is, I wanted to address that to this group because it was something I heard frequently as a doctor, and a lot of people came to me and said, "Hey, I'm afraid my kid's going to get this." The bottom line is the risk is lower to get the vaccination, and I still strongly recommend folks get the vaccination for their kids. Early on, Kevin, there was a tremendous opportunity to recommend and even influence folks to get the COVID-19 vaccine for kids by hoping and by talking about how it would help open schools. Now that schools are fully open, we're back to activities. I think the real question for us as public health practitioners is how do we motivate families to get kids vaccinated when there's relatively low risk for the kids. I will tell you, one of my children who was fully vaccinated, our son who's 7, got COVID-19 after he was fully vaccinated. Luckily, no one else in the family got it, including my wife and I, or our daughter. And he was sick and then got completely better and never had an issue. And I think many parents, many family members think, well, most kids who get it have no symptoms. But the real risk for kids getting it is that they spread COVID-19 and they spread it to mothers, fathers, other kids in the school, and maybe even grandparents who may not be quite as well. And if you spread COVID-19 to a kid who perhaps is on immunotherapy for cancer, or you spread it to a grandparent who's already ill at baseline, and then COVID-19 can have deadly consequences. And that's one of the reasons it's really important to make sure kids are vaccinated. So again, still strongly recommend that children be vaccinated. That will remain the position of the Louisville Metro Health Department. I expect that will remain the position of the Centers for Disease Control for the time period. With all that said, I do want to take a moment to say, what should we be thinking about after this COVID-19 quote unquote pandemic has gone down? And what does what does public health look like, and how do we continue to prepare ourselves? I'm going to be honest with you, and I don't fancy myself a conspiracy theorist by any means. I'll just go ahead and tell you, my father-in-law is a conspiracy theorist, and he knows it because I tell him that. But I do think I think we will continue to see pandemics, maybe not COVID pandemics, but pandemics into the future. Prior to the COVID-19 pandemic, we had the bird flu, H1N1. There was SARS, as many people remember, and there was others, MERS and others that had propped up. I think as the world becomes more populated and we continue to rely on some of these issues, I think we're going to continue to see pandemics crop up. And what I would encourage this group to think about as we hopefully are moving past some of the acute issues with COVID-19 is how do we prepare ourselves in the future? Hopefully, the scientific community will be able to rally and develop a vaccination. But I think what we've learned is it's very important to rely on groups like this and leaders like yourselves, like the folks on this call, to rally those communities together to overcome the stigma that relates to getting these diseases and to promote equitable opportunities for access to one treatment and access to vaccinations as we move forward. One of the areas that I'm particularly interested in exploring, especially as we move past COVID, is how equitable were we in distribution of treatment for COVID-19. I'm going to tell you, I suspect it wasn't as good as we hoped it was, and despite our efforts here in the metro area. And that's just a reality of the situation in which we exist and we function in. And hopefully there's going to be opportunities for us to do better moving forward.
Yeah, thank you so much for mentioning that. I think that's something that we all have been exploring and looking at. What are some of the lessons we can learn from this time, and that will help us be prepared for next time, if there is a way to get prepared. And as you were saying that, one thing that came to mind was really around misinformation, and one of the very first things we had to do, especially with this group, was making sure that the right information was reaching people. And so I wonder really what you see sort of will be the I guess the legacy that comes out of this in terms of making sure people are aware of public health updates that are springing up.
In terms of the legacy post COVID-19, Amos, that's a extraordinarily insightful question to ask, and it's one that I find myself contemplating more and more over the last several months, and especially the last several weeks, actually. And I'm going to be honest with you. I wonder if the memory of the public, if memory of most people is just so short that we won't appreciate how difficult COVID-19 was for us and make lasting changes. I hope none of that is true, and perhaps I'm articulating that only as my personal fear as a public health practitioner. But you kind of wonder, given the severity of COVID-19 and how negatively it influenced their life, but understanding that the media cycle changes every 24 hours. The news we see and the news that influence our lives is modified with one flick of our thumb as we go from next Twitter post to next Twitter post, from next Instagram post to next Instagram post. And I think that's true for all members of our community. And so the question is, how do we keep the issue of COVID-19, the issue of equitable approaches to emerging infectious diseases at the forefront? And I think myself, but hopefully other people much smarter than me, are working on that issue moving forward. What I hope is that as a Louisville Metro Health Department and as a community, we continue to work with folks who are members of this group, to talk about what we did good, but at the same time not hide where we did bad. And there's going to be areas we didn't do good, and especially I think we have to especially acknowledge that there's areas, um, in terms of equity, that we will have fallen short just related to the nature of the systems that exist and and we need to consider how we improve them moving forward. I think there's some real opportunities. One of the areas I specifically mentioned, I think we did a lot in terms of vaccine attribution in an equitable manner. But I fear that in terms of treatment, in terms of like monoclonal antibodies and things like that that are available that were in severe short supply, I really do fear that those were not equitably distributed. I have no information to suggest that or no data now, but I know that's one thing that I was continually asking for data on, and we really struggle to get that information. I hope I answered your question. You sort of put me into a moment that was a little bit introspective.
No. I think you answered it just fine.
Hey, I just wanted to share, you asked the question about misinformation, and I'll put this link in the chat, but I, as being someone on our end of the health department who does communications, and we create social media content, we monitor our content, and we often experience trolls, and we have experienced a lot of vaccine comments. So I was doing some research recently, and I came across there is a Center for Countering Digital Hate, and they have a really interesting report that they put out called the Disinformation Dozen. And there are 12 people who are responsible for 65% of misinformation across all social media, and 85% of what's misinformation on vaccines across Facebook. And then sadly, Facebook, the platforms don't really do a very good job of addressing misinformation. So if any of you all are interested in that, I will put the link to that in the chat. That's a really great resource. It's a Center for Countering Digital Hate. And those people profit off of the misinformation that they share, right? They are profiting off that. They sadly, and unfortunately, there are I think I heard another survey today that said misinformation contributed to 200,000 deaths due to COVID-19, that we could have saved 200,000 lives if it weren't for the misinformation. So sorry, that's like my soapbox, because I've been really digging into that.
Well,
Yeah, and
that's really fun. Oh, sorry, go ahead, Amos.
So I was just saying that's particularly, where I think, you were talking about us being, truthful about where we may have fallen short during response, and I think that's one particular area that we could have done a better job at in terms of the various information that was being shared.
Yeah, and I'll be completely candid. When COVID, and critical of my own profession in terms of physicians and scientific leaders in the community, I feel like, not in this community, but speaking overall, is I felt like those of us who are appointed to governmental positions, myself included, though I will tell you, in my Louisville Metro position, I've never felt this way, or did I ever feel really in my state position here in Kentucky. But I will tell you, I felt like, in watching this sort of play out over the course of the last several years, is that physicians in governmental positions and scientists in governmental positions have been too influenced by the politics of the day and how they present information. And I think they have not been as humble as I hope I would be in their roles to admit the faults of the science. And I think many of them wanted to speak to the public and say, here's the absolute 110% fact, and here's what you should do. And rather than saying, here's what our understanding is, here's what our recommendation is. And then if that information changes or that science changes, I feel like they should have been just more open about that. Instead, they tried to present a persona that was too absolute, too beyond reproach. And it wasn't the approach I would have taken. It certainly wasn't the approach I saw Dr. Moyer taking here in the Louisville metro area, or Dr. Hartledge. And I think if we would have done that better from a national level, we would have perhaps had less distrustfulness, if you will, And the example that comes to my mind is the mask recommendations. As everyone in this group probably remembers early on, many of the healthcare leaders on a national stage were saying, "Oh, don't buy back, don't wear masks, don't buy masks, you don't need them." And then within a month, we're coming back out and saying everyone needs to wear a mask, and it created a great deal of confusion. But what it really did was sowed extreme levels of distrust. When I think the message should have been, at the time, we don't have any data to suggest everyone should wear a mask. And what we also know is that masks are in really short supply, and we want to save all the masks we can for healthcare workers who are going to be exposed to taking care of sick people. So I think the lack of humility and a lack of willingness to admit to your own misunderstanding as physician leaders at a national level really uh, plowed the ground, if you will, i.e., set the stage for some of this distrust and misinformation that existed in our country. And I think my profession as a public health physician and public health practitioner was really hurt in a matter of public opinion. And what I would like to impress upon you to this group is, boy, I was really impressed by the truthfulness, the sincerity, and the candor with which Dr. Hartledge and Dr. Moria presented the facts around public health approaches to the COVID-19 pandemic. And I hope that as I sort of moved in this medical director role and continue to advise the community on public health approaches, is I use that same level of candor and say, here's what I understand, here's what I recommend based on that. And if I'm ever wrong, that I have the wherewithal to say, hey, I was wrong on this issue, but here's why my information changed, and here's what I recommend based off the current information. And I hope that you guys, the community, that's all you expect is truthfulness, honestness, and me to provide the best scientific judgment I can.
Thank you so much for that.
You
Kevin,
have a
you've
question,
had your hand up for a while.
Hello?
Who we got next?
I don't know. I had, go ahead, Jody.
Yeah, so there's a question in the chat. As a mother of a 1-year-old, what can I do to better protect myself and my child from COVID-19?
That's a great question. Currently, first off, for the mother, recommended vaccination based off the current vaccination recommendations, which we reviewed earlier. In terms of the child, vaccination whenever is appropriate and when the child meets the appropriate age for vaccination. A 1-year-old child should be getting regular well child checks, meaning routine examinations with the pediatricians. And I think this is an excellent question to bring up to a pediatrician. I think the general recommendations will be avoiding daycare if you're sick, if the child's sick, and appropriate testing for anybody in the home who may be have symptoms that may replicate COVID-19.
Kevin, did you still have a question?
I don't know if it's a question or it's something that came up today. I had a bunch I work with refugees and immigrants, and so they went to try to get the booster today. And obviously, these people cannot schedule appointments for themselves, and so they were struck by, but the fact that they knew today was the day to get vaccinated, the second shot. And once they get there, they couldn't get the shot because there's no appointments. And so I was sitting wondering, now that COVID has gone down and you're showing us a great map, why is it still kind of like, I understand the importance of appointments and all that, but is there anything that the public health department is working on along with this pharmacist to make the process a little easier?
Kevin, I couldn't hear part of your question, but most of it sounded like around folks who were trying to schedule vaccinations, particularly the second booster, and was having some issues getting appointments. Is that correct?
Yes, yes. I wonder, how do you consolidate just the fact that we are in green and everything is good, but there's still some kind of difficulty with people getting vaccinated, second booster and all that?
Well, first off, I would love to hear a little more details on that. It can be outside this meeting. If you don't mind, send Kathy an email or whoever your all's contact is on some specifics, and I'll try to work on that. And I'm very, very sorry to hear that was the case. In general, I think in terms of like the health department, we're moving to a more of an appointment-based vaccination model, just because some of the walk-in things we're doing requires an extreme amount of personnel resource time. And what we're finding is we're doing relatively fewer vaccinations. So we're paying people to basically go and stand, and they're not doing a lot of vaccinations. But I think you're probably talking about vaccinations in the community, and they're having they're seeing a pharmacist. So with that said, is first off, we provide vaccinations, including boosters, at our vaccination clinic, starting in June at the Louisville at our usual vaccination clinics at the Louisville Metro Health Department. I asked Kathy to provide that call-in number, and if we have an email link that's available, I don't know if it's available yet, Kathy, to folks who can get appointments. Most folks should be able to get vaccination in our community, but it will require an appointment. And I think the reason you're seeing that happen is that there's so few people getting vaccinated now that having standing clinics, meaning we pay that people out in the community are paying someone just to be available, just to provide COVID-19 vaccination. There's just not enough vaccines being given to justify that. So many people in the community are requiring appointments. Kevin, I think that's really the reason you're seeing that. But I would be interested in learning a little bit more about the specific situations you mentioned, because I expected most people would be able to get the booster in a relatively timely fashion.
Kevin, I will
No
just
worries,
add,
no worries at all. I think this was just one of those just one-time situation. They just went out there, they couldn't get vaccinated because with no appointment. So we were able to help them out, but I don't think it's happening on a larger scale.
Kevin, I just wanted to add, and I put in the chat that we do have still some vaccine community clinics in May coming up where you don't need an appointment. And one of them is at Americana on May 21st from 11 to 3. I put the link to our vaccination page in the chat too.
Thanks, Kathy.
Also, Kevin, I have to brag on you. I actually, Dr. Howard, want to brag on this entire team to you, because the misinformation would have been even worse without the leadership of these people. Almost in the Office of Globalization could not have been more helpful to us in connecting us to all of these people, and who were then taking our information out into their communities. And Kevin himself has a very nice YouTube studio and YouTube channel that I'm hoping he will invite you to be a guest. All of these people really did a great job of getting information out to our communities, and we just really owe a great debt of gratitude to them.
I'm going to be honest with you, Kevin. My kids, if I was on your YouTube channel and they could search me on YouTube, they may think I'm a superstar, because my kids are constantly watching YouTube, and we'll have to look you up. But I'll tell you, the work that groups like this do is in terms of orienting the community and fighting back disinformation and for positioning the communities, and specifically the communities served by this group. It's just unreal. And I'll tell you, I know I want to acknowledge, I'm a white male. I don't, I don't, I'm not one, I'm not someone you particularly thinks a minority, but I grew up in rural Appalachia, Kentucky, to a poor family. All my relatives were coal miners, and none of them went to college. And I tell you, reaching communities like that, I know from experience of reaching the poor white folks in Eastern Kentucky is hard. And I'm not suggesting that there's any poverty in the groups y'all represent or reach out to, but you make inroads to them that make a difference. And I've been able to do the same with my own with folks in my own community back home, and I'm sure you guys do the same here. And the work that you do can't be applauded enough. And I say all that just to say, sincerely from the bottom of my heart, it's not lost on me what y'all have done. And I know I wasn't with you in the trenches during COVID, and that was Dr. Harledge, and nothing could, you know, I, I just wanted you to know that it's not lost on me, and I really, really appreciate it, the work you've done, and I know that Kathy and the rest of the folks at the Louisville Metro Health Department certainly know that you made a real difference, and you've saved lives. You've probably saved as many lives as any doctor in Louisville has, actually at providing treatment, and you should be proud of yourselves for that.
I know that Dr. Howard needs to scoot out at 5 o'clock, and there's one last question in the chat. I wanted to get to that quickly, Dr. Howard, if you don't mind, and it's what can we do to be ready for any upcoming variants?
Well, that's a fantastic question, and I think there's multiple levels on which we can consider that question. One is, what can we do as a health department? And as a health department, we have to be more prepared to mobilize and respond quickly when a variant comes up. I think when COVID-19 happened, everybody was on their heels, and that includes the Louisville Metro Health Department, but also includes us, national, state government, federal government, and every other agency responding. I hope moving past COVID-19 that we have developed systems that have put us in a position and are more ready to respond. Taking that to a more individual level, I think the question is probably oriented to that individual level. What can any person do to respond more quickly? I'll tell you one thing I wish I would have had when COVID-19 responded. Even as a doctor, I wish I would have had some masks at home, especially some N95, these micro-protective masks. So I think one is having some masks available should you need them. Two, having common sense approaches. So one, understanding your own health situation is extremely important. I think if you're someone who is extremely sensitive for whatever reason to respiratory viruses, then you need to take an extra layer of precaution and understand that respiratory viruses are really the most common types of viruses that present a pandemic type risk. Thinking H1N1, SARS, again, those sort of viruses that we've talked about that popped up over the last several years. And then three, understanding your individual risk profile and taking precautions that apply to that. And probably finally, and perhaps most importantly, is being sensitive to the risk of others. So if you know you're ill, if you come down with symptoms that are suggestive that you have some type of illness, specifically while we're still in the COVID-19 pandemic, is not going to work, not going out in the community, going to events and exposing other people to the illness, but rather take appropriate precautions when you can, work from home, stay at home, and wear a mask to help prevent spread of illness in the community. So those are four fairly simple things I think most people can do. They just take some level of self-awareness to do.
Well, we are at time, and thank you so much, Dr. Howard, for being with us today and to provide such timely and important updates. And thank you, Kathy, for setting this up, and also your team always being ready to, provide both information and accessibility to resources for this community. Really, to echo what you said, the partnerships built during the pandemic, specifically with this group, could not have been any better. And I think going forward will, help in terms of building trust, but also making sure that everyone has access to the right information and right resources. So thank you so much, Dr. Howard, once again.